Hey everyone, Dr. Darian here, back for part 2 of the case of the patient with chest pain whose ex-wife gave some crucial information that led to the diagnosis. So again, while I'm talking to the wife and the patient is receiving their CT scan, the CT tech runs out of the room and wants me to look at the image because they recognize something very abnormal. For the sake of TikTok Med School, this is a cross-section of someone's chest. This is normal. To break down what that image even was, you have to understand that in radiology, we're looking at different planes of view. And if you can notice that bright green cross-section or horizontal view, imagine if you can just slice through someone's chest and look in the inside. That's what we're looking at when we're looking at a CT scan. So we use that plane of view to memorize anatomy in medical school. So this is a cross view or an anatomical reference of someone's chest. You can look and you can see the hearts and the lungs. If you pause it, you can identify the other organs. Again, this is a cross section of someone's chest. So in CAT scans, we give contrast. And so essentially the black is air. And so those are someone's lungs. That's why you don't see anything. In the middle, the contrast is lighting up bright white. That's highlighting something called the aorta, which is an important blood vessel in our chest. It's actually the largest blood vessel in our body. And this is what the patient's CT scan looked like. They were having a specific problem in their aorta. If you can notice, it looks very abnormal. That white is split in the middle by something. That is an emergency. So again, our aorta is the first blood vessel that leaves our heart. It is the largest, most muscular blood vessel in our body. It's actually the size approximately of a garden hose, and it splits up into a lot of different tiny arteries that supply all of our important organs. In certain patients, especially those who have chronically elevated blood pressure, the wall of the aorta can tear and it can cause blood to go from the middle of the aorta where it belongs into the wall and lead to something called a dissection, which is a medical emergency. Blood can then travel into this false lumen, and if you can imagine, if it's in this space, it's not going to get to anything important, especially the organs in the body, and it can cause a huge problem. So that is what is going on with this patient. If you look at the CAT scan on the aorta, you can see it is larger than normal, and you can see there are two compartments of blood, one where it belongs and one in the false lumen where it does not belong. This patient's aorta was dissecting and needed immediate medical intervention and surgical revision with our cardiothoracic surgery team. So aside from acute medical intervention, managing the patient's blood pressure, their heart rate, and their other comorbid issues, this patient needed a graft to be placed by our cardiothoracic surgery team. And this is similar to what it looks like. Essentially, they go into the operating room and place a stent inside of their aorta that allows blood to flow normally where it belongs. The textbook sign of this problem is when someone has chest pain ripping to their back, but not all patients present in the same way, so all the training doctors who are watching this, you always have to have a reasonable level of suspicion and making sure that you rule this diagnosis out. Alright, you've learned a lot today, not just in anatomy in terms of what is an aorta and how to interpret a CT scan, but also the signs and symptoms of an aortic dissection and how it's treated. Let me know your questions and comments below.